The Trauma Registry in Montana. The Montana Trauma Registry was established primarily to ensure quality of care through performance improvement, enhanced hospital operations, injury prevention, and generation of quantifiable data. The function and purpose of the registry is to facilitate simple and accurate trauma data reporting for internal uses and for state requirements, and to assist trauma hospitals in identifying patient populations in their region or town. The Trauma Registry will help identify issues in patient care, system issues within your facility, and activities that can be identified for injury prevention. How good is the charting and documentation from EMS in the facility? All of this can be evaluated using the Trauma Registry. Data talks, anecdotes walk is really the theme of any evidence-based system. Without data to analyze, trend, and identify issues, we have no evidentiary base for our program activities, much less a method for determining true improvement. It is no longer adequate to describe what we believe went wrong or how we think things are. We need a system to collect the data that can illustrate it. The collection and use of data is of paramount importance to a successful trauma program. It is involved in local, statewide, and national data banks. It is essential that all facilities that are ACS verified, state designated, or are planning to become designated must be current in their state trauma registry data input. All trauma facilities, regional, area, and community trauma hospitals use the CV5 software to upload their data to the state's centralized data bank. There are currently 10 facilities that use the desktop software program and download their cases to the state registry. These are busier facilities that see more patients and generally have more resources available for care of these patients. All other facilities use the web-based version of the software. Here are the 10 current contributing facilities. Let's talk now about a little history. The State of Montana Trauma Registry formally began with the CALES registry software in the 1990s. In 2004, CALES was migrated to the Digital Innovations Collector Trauma Registry software program, which the state provides to larger hospitals who submit their data electronically each quarter. This has been upgraded over the years, and we are currently on the CV5 version. The state of Montana houses the centralized registry software, where data is uploaded from software facility users. The volume of patients seen at facilities determines whether a facility has the computerized software version or uses the web-based version. A web-based trauma registry was developed and implemented in January 2015. It replaced the paper abstract submissions used by smaller volume facilities. This is an abbreviated version of CV5. Data can be entered for all Montana facilities, even those not currently submitting case data. Each facility is given an identifying facility number so that de-identified patient data can be integrated and tracked. Facilities using the computerized software version of CV5 may create reports about their facility's patient population using the report writer. The state can use their software to run reports too, as needed. Here are images of the case entry screens for the software-based registry and the web-based one. Individuals who want to be state trauma registrars must meet the following criteria. Registrars must take a state trauma registry course done virtually for the web-based users. Current software-based registrars are grandfathered in if hired prior to July 1, 2014, and if hired after July 1, the registrar must attend formal training. Besides the state course, registrars must attend or have previously attended the following 2 courses within 12 months of being hired. 1. The American Trauma Society's Trauma Registrar course, or the equivalent provided by a state trauma program. And 2. The Association of the Advancement of Automotive Medicine's Injury Scaling course. Lastly, registrars should have 8 hours of registry-specific education per year. There are defined criteria for which trauma patients are included in the registry. Included patients represent the next level up in care resources required, not every patient with injury. These criteria are generally discussed annually for inclusion or exclusion by all trauma coordinators and registrars, and recommendations are submitted to STCC for consideration. Please see the current trauma registry patient criteria, which can be found in the resources part of this module. What data is included? Some of the data collected is demographic, including race, gender, ethnicity, age, and insurance payer info. Why include demographics, you may ask? We want to identify trends regionally and as patients move across the state. For For example, we have identified racial differences in injury occurrence. We have identified trends and mechanisms of injury, blunt and penetrating causes of injury occurrences by age and gender, and trends in reimbursement. The rest of the data included in the registry tracks the patient from incidence to discharge. We would encourage facilities to use the trauma flow sheet when documenting care of the trauma patient. The trauma flow sheet can provide cues about care and what should be documented. This flow sheet can be found in the resources section of the module. Let's cover more about what the documentation includes. Here's what is required of pre-hospital documentation. And this is what is required of emergency department documentation. If you're looking for when registry submissions are due, here is a visual of the 2021 calendar. Submission dates occur quarterly on Fridays. You have the data uploaded. What reports do you want to generate from it? Trauma coordinators work together with trauma medical directors to decide what reports will be needed, when, and for which committees. The trauma registry information could be used by your facility to determine performance improvement issues, identify processes needing revision, identify injury prevention activities, or identify educational opportunities for staff caring for trauma patients. If you need assistance with the registry, you can reach out to ESO directly or Carol Cussman.